I'm just saying that for medical schools, they want to make sure that you're in this for the patients as well, because only doing it from an intellectual level doesn't make for happy physicians. Application Renovation Season 2, Episode 11. How are you today?
I'm doing well, Dr. Gray.
All right. I'm excited to have a chat with you, find out kind of maybe where you went wrong, where you went right with your last application, and hopefully get you moving in the right direction to get into medical school. Sound good?
Sounds great.
All right. Before we jump into your application, I want to hear from you, kind of your thoughts on what went right, what went wrong, if you had any interviews, if you got any feedback. What did that process look like for you?
Yeah, so I've been fortunate enough to get one interview out of 24 schools that I originally applied to last June. That interview was back in January of this year. I have not heard any feedback from that interview. I've not gotten any interviews since. I've spoken to my pre-med advisor at the University of Connecticut, and I talked to him actually before I got the interview about steps going forward.
Okay.
And he suggested to look more towards my GPA. Might be a pitfall with my application, but that was very brief. And I don't think we had a really in-depth conversation about other aspects of my application.
Okay.
I haven't had much feedback up to this point.
Okay. Well, we'll get in depth to your application now. So one interview, that's great. Let's hope there's still a chance to come off a wait list or come off of whatever is holding you back. But if we need to reapply, let's go ahead and take a look at your application. So we're starting off here on page 3. Just so people understand. Again, I always like to highlight when students submitted an application. So you were on top of it, submitted June 9th, and it still took almost a month to get your application verified. So you missed that first wave of applications going out. That's okay. In the grand scheme of things, that didn't do anything for your application, hurting it in any way. We're scrolling through your list of your grades, and a lot of B's is what stands out to me. 1 C right at the beginning, and then kind of senior year, looks like you turn it around, and that's great. And what I highlighted here in this grid of scores is just the continued upward trend, right? 298, 323, 368, 385, all with pretty decent course load of science credits. Your all other GPA also followed the same suit of starting off kind of poorly and then going up and up and up and up. And obviously your cumulative science and your cumulative all other and your total GPA are not amazing, but for me, your GPA isn't an issue because of that upward trend every year, showing improvement, showing growth, and just showing, hey, you are a normal college student who stumbled coming into college. And if a medical school doesn't see that, doesn't like that, then too bad for them. There are plenty of students who easily overcome this. And that's why a lot of times I get mad at students when they're like, oh, I have a 3.4, I shouldn't, I need to do something else. I'm like, well, what does your trend look like? And this is the perfect example of an amazing trend of started off poor, figured it out, right? And so final GPA, not amazing, but medical schools aren't just looking at your final GPA. They are looking at those trends. Now, obviously, your final GPA has to be above a certain number that they're screening in or screening out, but your 3.44 science GPA, your 3.48 total GPA, that is going to likely be high enough for almost every school to get screened into a continued review. So not a problem. And then your MCAT obviously is not a problem with a 514. So great upward trend. MCAT score is solid. Your stats, to me, are not an issue. Great. Now, going back to kind of the continued trends in this application renovation series, which is kind of the core of my entire message with medical school headquarters and all the podcasts I do, is what is your story? Students focus a lot of times on stats. 3.9 GPA, 520 MCAT score. I didn't get into medical school. What happened? Well, let's look at the rest of your application. So that's what we'll do now. All right, so stats for me, not an issue. Looking at your experiences, we get to your research, your poster presentations, and which are great, right? It shows that you're inquisitive, you're thoughtful, you're doing some good research stuff. So you have the poster presentation, you have the publications, you have research, great. Something I highlighted a couple episodes ago was how students, for your research lab, research technician experience, you wrote that kind of studying the disease of cystic fibrosis has shown you that how scientific evidence plays an indisposable role in physicians' differential diagnosis. Right, a lot of students love to put in that kind of duh kind of statement, right? Of course, research plays an important part in a differential diagnosis. That's how we have medicine in the first place. That's how we know how to treat people, diagnose people, is through research and science and studying this stuff. So a lot of students will put in that statement, and it doesn't mean anything. I need something more substantial, more about who you are as a person. So just kind of the first note here. The responsibility side here, I'm glad that you didn't continue this throughout the rest of your activity descriptions, where you said, briefly, my responsibilities include mouse husbandry. I don't know what husbandry sounds like. It doesn't sound like a very good thing. Like I get a weird picture of what you're doing with mice, and I'm like, whoa, like, hey, keep your fetishes out of this application. Tissue culture, phlebotomy, it's research. I don't need to know the exact stuff that you were doing. That type of statement to me is just a waste of space. Okay. The sales pitch right off the bat in your most meaningful. Remember that most meaningful is, why is this most meaningful to you as a person? And you made it a point here to kind of sell, my strong worth ethic did not go unnoticed. Right? So right off the bat, I'm like, I don't need to know that. It's the sales pitch is just overdone in students' applications, right? Which goes back to the story. What is the story of why you're doing this? What are your motivations for being a physician? Show me who you are as a person. Show me your impact on this world. Not that you have a strong worth ethic that was rewarded. Okay. So lots of research experience. Obviously, something that you're interested in. You get to the EMT work that you did. You marked it until June of 2019. Did you stop working as an EMT at that point?
I did. 4 applications, actually.
Say that again?
I stopped working as an EMT when applications came around to fill out the applications and do my secondaries that summer.
Okay. So what that looks like is I'm just going to check a box and move on. Okay? So if you're not continuing, and a lot of students yell at me for this type of statement, if you're not continuing to get clinical experience, it looks like you're just checking a box. Now, you may not like being an EMT. I'm not saying you have to be an EMT, but if you don't have other clinical experiences that show that you are interested in being around patients and other stuff, then that's a question mark. And you may have more here, and we'll get to the rest of the list. So that's just something that stood out to me as I was glancing through this, right? And so I try to just top of mind, what comes to mind as I'm going line by line by line by line, which is what a reviewer is going to do as well. Right. Just a kind of a, what's the word? A style thing for me. I don't like initials for talking about patients, right? Use names. They're more memorable as someone's reading this. Like KF doesn't mean anything to me, but Jan, like, oh, I know a Jan. I can picture a Jan, right? And it's only one extra character. So that's just a style thing. Use quotes the first time you use it to signify that it's a fake name. Yeah. And in here you have some negativity, which I try to tell students to avoid, right? I've been warned by other coworkers that KF was a tough person to please. Like, the negativity doesn't need to be there. And what you're doing is selling that, oh, look how open-minded I am. Look at how empathetic I am. I can connect with anyone, even the tough ones, right? That's what you're trying to highlight there, and you don't need to do that.
No need. Okay.
Yeah. Just tell the story of how you connected with her, what that meant to you, the impact you had on her, how that impacted you, etc.
Yeah.
Okay. So the trustee board of chapter advisors you have here, I want to know what the impact was, right? I don't see really any impact. It was just kind of, here's the role, here's what it was, and that's about it. Okay, so talk numbers if you can. Your TA position, again, the story behind a TA, you have a very generic, what a lot of students do when they have these TA or tutoring positions, right? You talk about, it forced me to adopt a novel way of teaching. Well, it's not novel, it's just different for you, right? Novel is like COVID-19. It's this brand new coronavirus. So a lot of students focus on, look how adaptable I am. Look how I can kind of communicate with anyone. Tell me a story of a student that you helped, and I can see through that story how well you work with someone else and how adaptable you are to working with someone, right?
So expand on that more, as opposed to saying the punchline. Talk about
as opposed to trying to sell that you are adaptable, right? Which you used at the very end. Tutoring gave me an insight into the importance of adaptability. Well, of course, you need to be adaptable. You're going to have to interact with a lot of people. And so what you did, what a lot of students do, is go, okay, what are the skills necessary to be a physician? Oh, you have to be adaptable to interact with a lot of different types of patients, even the tough ones, like you sold as an EMT. And so you're like, okay, I'm going to use this experience as a tutor to show them, but you didn't show, you sold to me. I'm going to use this experience to sell to them how I'm adaptable, because I think that's what's important as a physician, and that's what they're going to like in my application, right? As opposed to just telling me the story of being a TA for little Johnny and how you were able to help little Johnny go from a C to a B+, right?
And let them fill in the adjectives.
Let them see it, right? Let them feel it through your writing. Okay?
Yep.
Again, much more research. So at this point, I'm like, okay, EMT experience only shown this far. Did it for a short amount of time, stopped it. Tons of research. Are you sure you don't want to be a researcher? Like, do you want to go to medical school, or do you want to go to PhD, like go to a doctoral school? So that's what I'm thinking at this point, trying to formulate. The experience that you had here, that I highlighted for the most meaningful, was a lot of students make this same common mistake, is focusing too much on the admiration of the physician. Right? You say, what I admired most about him was his attention to the specific needs of his patients and willingness to listen to families and staff. Okay, he was a great guy. I want to know about you, right? I want to know about you and what your motivations are and why this was meaningful to you. Not that Dr. Smith or whoever this is was awesome. Okay. The student health outreach team. So you had this experience, again, numbers to show impact. How many lives did you impact? How many students did you impact? How many of these events did you hold? Were you organizing events? Were you managing people? That will show impact, other than just kind of generic what this activity is. After reading this, you mark this as medical and clinical. After reading it, I'm wondering if it is medical or clinical experience. You talk about events, and it looks like it's mostly focused on just getting the word out about screenings, or were you actually doing the screenings with patients?
We were at food clinics and screenings, just signing in other students. We weren't administering food shots and whatnot.
Okay.
I guess it would be more of like a community service.
Yeah, so for me, not clinical, right? If you're doing administration work at a flu event or something, right?
Yeah.
So a very common mistake, right? Again, of this is around a clinical thing, or this is in a hospital, therefore it's clinical experience. So after reading it, I'm like, I don't know, is that clinical? Is it not? I probably would have given you the benefit of the doubt reading this without being able to talk to you. But reading it doesn't signify anything to me about it being clinical. So that's a potential issue. And again, going back to the full story is, do you have enough clinical experience? And then I have this one that marks clinical, and then I question, is it clinical? That it's just, things are starting to add up as to this story isn't making sense yet. Let's hope it comes together at some point. The student supervisor, right? You, again, have some responsibility lists in here, the job duties that students like to give. Give me a story, supervising someone. What did that look like? And then I can see through that story that you're a team leader, that you're a good organizer, a good communicator, that kind of stuff, without you having to sell that. The hospital volunteer that you have listed here, the hours that you did, I wouldn't recommend doing this, how you listed it as 4 different hour entries from 9/2015 to 5/2016, 9/2016 to 5/2017, right?
Just group it all.
Just 9/2015 to 10/2018, like those small little gaps of the summers where maybe you weren't around. Ignore that. I've heard some horror stories where the data doesn't get pulled down properly and schools only see like the last entry that you have. I think for those short amount of gaps, I think you just combine it all, and you don't need to mention that, oh, I didn't do this during the summers. Just don't worry about that kind of stuff, right?
Okay.
To me, that's not fraudulent or lying or padding anything. If you did only the 9/2015 to 5/2016, and then on here, the 1/2018 to 10/2018, and you only put that as one block from 15 to 18, then I'm like, well, that's that doesn't work really well, right? And so again, I look at this hospital volunteering, and I'm reading it, and again, I'm to the point where I'm like, is this clinical experience? Because you don't really tell me what you were doing other than you saw that this patient was in distress, and you were able to get a pamphlet to the patient because they overdosed, right? And so I'm like, what were you doing in the experience? So without listing job duties, show me the interaction with the patient so that I can go, oh, you interacted with patients, right? Mm-hmm. Tell me a story. So again, I'm a little confused. And then your takeaway here is the volunteer experience left me wanting to do more, which prompted me to become an EMT. But that story doesn't really fit because you started this in 2015, right? And your EMT experience didn't start until 2018. Right. So I don't know how much that story fits, right? Remember, I'm trying to put together who you are and what the story, and so I'm still a little confused about the whole story. Okay? You with me so far?
I am with you.
All right. And then we get down more, some older time, painter's apprentice, great experience. You told a little bit of story, which is great. I like that. And then you have physician shadowing at the very end. It started early. It ended in April of 2019 that you have it on here. Did you end it again because applications and you're like, okay, I'm done. Check, I'm done. Again, I like students to show that they are going to continue doing activities that prove to them that they want to be a doctor, that prove to the medical schools that this is what they want, not, hey, medical schools, I checked all the boxes, I'm done, I'm going to go do everything else I want to go do now. Right? That just looks like a little bit of a red flag. Plenty of hours, right? Your hours are great at 105, but the stop date of April 2019 is what I'm like, well, what are you going to do now? Like, are you done? Right? Actions.
So project that better.
Exactly.
Because I actually have shadowed since.
Perfect. Yeah. And so a lot of times students forget that they can put the stop date as the anticipated start date of medical school, and kind of anticipate and guesstimate those hours as well. Yeah. You have here philanthropy chairman. You have impact here, which is great. $3,000 for the hole in the wall gang camp. So that shows me impact. That's the kind of stuff that I like when I say, show me numbers, show me impacts for these kinds of experiences. Carpentry, great. All right. Getting to your personal statement. This is where I hope everything comes together and I can really understand who you are as a person, why you're doing this. And so I get to the beginning and I see, oh, your mom is a nurse. Great. That's going to potentially be a good seed here. But you don't use really your mom being a nurse as the seed. You focus on the love of finding answers as more of your seed than anything. And so you say, as I got older, I loved finding answers, moving chess pieces in a difficult game, building Lego projects, even dissecting cat in anatomy class, right? We all have our Mr. Bigglesworth. I loved my cat in high school. And so
Barbara.
Barbara, I love it. When I look at that, right, I go, oh, this is someone who is just in it for the mental game of being a physician. right? And you even focused on that. And I didn't see this last night. I was reviewing this, preparing for the call today, but it makes more sense. Earlier, your takeaway for one of your research things was how scientific research helps with the differential diagnosis, right? And now you're here going, oh, I love finding answers, right? So everything is pointing to you just love the intellectual side of being a physician. You haven't done enough exploring the actual being a physician side of being a physician, which is why your story isn't really coming together at this point. Does that make sense?
So the being a physician side of it, the service to your patients, the relationships that they have, and how impactful therapeutic relationships are on people, that part of it.
And not just relationships, because you can have relationships anywhere, but the impact that you can have on a patient, the impact that you have had on a patient. Mm-hmm. And maybe that's what's missing. Maybe you haven't had enough impact on patients because the things that you've marked as clinical experience aren't really clinical experience. And maybe as an EMT, maybe you were just doing patient transport and it wasn't super impactful for you. And maybe you need more exposure in a clinical setting, a more traditional clinical setting, to see that impact, to feel that impact, and then be able to describe that impact in a story, be able to communicate that impact in an interview.
Right.
Okay? So going back to the story, going back to your personal statement, it looks like as an EMT you had a good experience here, but again, you focused on I racked my brain searching for possible reasons why this man was sick, right? You're focusing on the intellectual challenge of being a physician. And I had a great conversation on the pre-med years, and I don't remember the episode, but it was with the director of admissions of the University of Illinois, right? Chicago is where she's at, but all of the University of Illinois campuses. And it was Layla Amiri is her name. I don't think she has her doctorate yet, but maybe she's Dr. Amiri. We'll go with Layla at this point. And so having that conversation with Layla, she really told me a good story of a student who was just really disappointed through the application cycle, wanting to go to Illinois, not getting in, getting feedback, because her story was, I really like the intellectual challenge. I want to figure this stuff out. I want to know everything. I want to explore everything. I want to examine everything. And there really was no connection to, I'm in this for the patients. It was all, I'm in this because I like the intellectual challenge. And her statement on the podcast, which was really powerful to me, was, I don't want to be your testing ground for your intellectual curiosity. I want people to come to my medical school who are going to care for people, not who just want to learn all day long. Does that make sense?
It does.
So when I read
Especially
this,
where I work, it's sometimes like that. So.
Yeah, exactly. So when I read this, that's the path that I'm going down with your story. Now, you may go, but I do love the patients. Great. We just need to massage your story and show that side of it. Okay?
Yes.
And so we get to a little bit more selling with Frank. I'm glad you used a name here. You used the single quotes, which is great. You don't need to use them every time. I just mark that on here. You don't need to use the single quotes every time, just the first time for the pseudonyms. And then a little bit of a sales pitch here saying my prior training coupled to my decisiveness to act to an improvement in his condition, right? Of, look, I'm ready for this. I'm decisive. I know how to get to a differential, figure out what's going on, and I'm going to be good. Okay? That's not the goal of this, right? Why medicine? Why are you doing this? You did mention relationship here in the story, which we just mentioned a minute ago, right? Don't focus just on the relationships because you can have those anywhere. You get to the end of the story here, and your reflection of why was this impactful for you was the fact that it was just humbling, right? And to me, I'm still left with, okay, why does that make you want to be a doctor? Not just because it was humbling. Why does this make you want to be a doctor, right? That story. You have this next paragraph is your cystic fibrosis research. Great. I don't like talking about research in a personal statement.
Yeah.
It doesn't lead to why medicine. It's in your activity list already. I don't need to reread it in an essay form.
Okay.
Okay. Again, right? Your focus and your conclusion here, the second sentence, I found getting to the bottom of that question to be captivating, right? Going back to I'm doing this for me so I can be intellectually challenged. I like the chess pieces and Lego and all of this stuff. Right? I'm not doing it for the patient, I'm doing it for me. And that's most likely, not your GPA, that's most likely what kept you from getting more interviews. Okay? Right? Again, I enjoy seeking out the answers to all my questions. Just more of the same. So, we get to your school list. Just glancing at your school list, I thought your school list was pretty good. You had a couple out-of-state public schools, which are usually higher risk. The one on here, obviously, University of Massachusetts, right next door to where you are, so not a huge issue. But I think overall, it's a really good school list that fit your stats. The GPA may have been an issue, but again, I think that upward trend, they can see that and they can understand that your GPA is probably not an issue. And then with the strong MCAT score, I think you would have been competitive at a lot of these schools, but the story just fell completely flat, and they didn't connect with you, and they didn't understand why you want to be a doctor, or they understood that why you want to be a doctor is for your own intellectual curiosity, and they don't want that at their school.
Okay.
Questions?
So the list you think was appropriate?
Yeah, I think I think the list is appropriate. A lot of private schools that aren't looking at state residency. A few public schools that fit who you are and where you are. So that's fine.
Yeah. So my question for you is, I can go over what I've been doing since this application, and then we can talk about what's next.
Sure.
How can I improve this and really culminate my story?
Okay.
Into something that they would really be interested in reading.
Okay.
And more about me. So since graduation, since applying last June, I've continued to be working at the lab at MGH, doing the cystic fibrosis research. I've also started tutoring a middle school student, Cambridge Public Schools.
Okay. Tell me clinical experiences. What are you doing clinically? What are you doing shadowing wise?
So I've continued to shadow my boss, a pulmonologist.
Okay.
When she's on service, I'll join her for 1 or 2 days every few months or so. And then clinical experience, I've actually started doing ski patrol. So I did ski patrol all winter. So it's interesting. It's like EMT was a lot of older people medicals.
Yeah.
Now I'm getting a lot of the pediatric traumas from the ski patrol. So it's been a very cool experience.
Nice.
I've become a better skier for it. Gotten better at dealing with patients and their families, because when you have hurt kids, you also have the parents who are your other patients too, in a way.
Yep.
So that's what I've been doing this winter as well.
Okay.
And then right now I'm kind of at a hiatus here, figuring out what my best next move will be, whether to continue working in the lab, maybe go continue to work as an EMT next year, or work in an ER somewhere.
Yeah.
Or go to take classes.
Yeah. So I don't think you need classes, right? Going back to your GPA, your upward trend shows that you're capable. Your MCAT shows that you're capable. For me, your classes are not an issue. The ski patrol is great. It's EMT on the mountain, right? EMT on skis. Just as the ski season ends, make sure you pick up something else and you're interacting somewhere else. I don't think you have to stop doing research. I don't think having a ton of research is necessarily a negative thing. It obviously goes towards potentially your weakness in your application, that you're inquisitive and that you like to think and come to the bottom of things, right? That just is more to that point. We just need to focus more on the patient care and focusing on patients and impacting patients and what that is like for you. And then focusing better on your seed that I write about in my personal statement book of what was the initial exposure. Not that you're inquisitive, but what was it like to have your mom be a nurse, and not necessarily like why does she care for the kids and not me, but what kind of stories do you remember her telling, and have that conversation with her to say, hey mom, do you remember it all when I became interested in what you were doing and I asked questions about the patients you were seeing and treating and whatever, right? And try to come up and find those memories deep down in your brain to potentially spark a launching off point for why you initially became interested in healthcare, not from I'm an inquisitive standpoint, but from this is a really cool way to impact a person's life.
Yeah, no, that's a very good point. Go back and talk to my mom and learn more about her career. Mm-hmm. And then, so you think the continuing research for another year is okay? And then,
if you love doing it, continue doing it. Just make sure you're getting the other experiences that show you on an emotional level, not a intellectual level, why you want to do this for patients. And I'm not saying that it's wrong to want to do this from an intellectual level. I'm just saying that for medical schools, they want to make sure that you're in this for the patients as well. Because only doing it from an intellectual level doesn't make for happy physicians.
No. Yeah, you'll burn out. I agree.
You will burn out. And there you can just go into graduate school and get a PhD if you love the intellectual side of it. You don't have to do the patients. And maybe you get to a point where you're like, you know what? I don't want to do it for the patients. I love just the research, and you do that. And that's okay too.
Right. So going forward then, do you think that it'd be wise to, wait another year before reapplying if need be?
If you
turn around this June.
Yeah, if at this point reapplying right away is almost always the wrong answer, especially for someone like you who doesn't have the experiences that are painting the right picture. So get some more experiences, figure out your story a little bit better, and then reapply when you're ready. Now, for you, that means retaking the MCAT based, I think, on your MCAT date, which kind of stinks.
Yeah. So the MCAT's July 2018.
Yep.
I don't know if that's going to be good for June 2021.
It might be. Check with some medical schools, but just because the MCAT may expire isn't a good reason to rush an application and still not tell your story well enough.
I agree. Absolutely. Okay. It's a big investment in time and cost and everything else.
Exactly. So. All right. Well, if you have any other questions, shoot me an email. I hope this was helpful for you to hopefully give you some advice, some guidance to focus in on for your next application. Thanks for coming on and sharing your story and hopefully helping a lot of other people along the way.
Yeah, thank you so much, Dr. Gray. That's awesome.